And hello, everyone, and welcome. Thank you for joining today's Needy Meds special topic webinar. And it's a really important topic titled Find Financial Assistance for Patients with Rare Diseases, presented by our long term partner, the PAN Foundation. As I said, my name is Carla. Oops, jumped ahead of myself there. My name is Carla, and I'm the Director of User Engagement at Needy Meds. And as many of you, I'm seeing a lot of familiar names, have joined us before for these webinars. I always like to get started with offering a few tips so you can make the most out of the presentation. First of all, if you do have questions, we encourage you to submit them at any time throughout the presentation by typing them into the questions section. For some of you, it may be the chat section of your GoToWebinar control panel. Just a heads up that we do reserve answering questions until the end. And if for some reason we don't get the chance to answer your specific question, we will follow up with you by email. But of course, we will also provide the contact information for both Needy Meds and the PAN Foundation at the end. I'm happy to share that this webinar, like all of others, will be recorded, converted into a video, and uploaded to the popular Needy Meds YouTube channel. And I always recommend people subscribe because that way you'll be notified when new webinars, videos, or presentations are uploaded and you won't miss out on anything. As you saw on my initial screen, we also uploaded some materials we thought you'd be interested into the handout section of your GoToWebinar control panel. And one more quick little tip, and it's about that GoToWebinar control panel. If it is smack dab in the middle of your screen, obstructing your view of our slide decks, you can simply drag it to the corner out of your way. I just want to caution you not to X out of it because that will shut you out of the webinar. So with that, I also like to move on to just a little bit of information about what Needy Meds is for those of you not yet familiar with us. We're a national nonprofit founded about 25 years ago now. And what you're looking at is our mission statement, but simply put, Needy Meds connects people with healthcare savings resources. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. That information will be available at the end of the presentation as well. And I will also share that we are available, our helpline counselors are available weekdays from 9 a.m. to 5 p.m. We're in Massachusetts, so that is Eastern time, and I'm happy to share we also have Spanish-speaking counselors. So let's talk about why everybody's here today, which is the PAN Foundation and how they can help those living with rare diseases find financial assistance. What you're looking at on my screen, up on yours now, is just a screenshot of the panfoundation.org. And I put that up there, obviously, so you can see what their website looks like, but it gives me an opportunity to showcase it because they put a lot of work into not only the resources they offer, but making them accessible and easy to find. So I'm happy to let you know that if you go to that website, you're going to be very pleasantly greeted with a well-designed site that is easy to navigate. So the PAN Foundation, those of you that are not yet familiar with it, we're happy to introduce you to them. As I said, PAN Foundation is a long-term partner with Needy Meds, and they help underinsured people with life-threatening, chronic, and, as evidenced by today's webinar title, rare diseases, get the medications and treatment they need. And they do this by paying for their out-of-pocket costs and, importantly, advocating for improved access and affordability. So now let me tell you a little bit about my friend and our guest, Rich Centrenbaum. Rich is the Vice President, as you can see, of operations at the PAN Foundation, and he has worked in the healthcare industry for more than 25 years. He spent the last 10 years developing operational strategies and leading highly effective healthcare call center teams, including those for healthcare foundations. Rich has extensive experience in overseeing operations, quality, training, business strategy, business analytics, and IT functions relating to FDA and OIG regulated patient support programs. Prior to joining Pam, Rich worked for Eli Lilly and Company and Johnson and Johnson. He has a background as a registered pharmacist and he graduated from Rutgers College of Pharmacy in 1992. And as you can see from that impressive bio, we are so happy to have Rich share his expertise with us and our Needy Meds audience today. So without further ado, I'm going to go ahead and pass the mic and the screen to Rich. And he's going to pull up his PowerPoint slide deck. And as he does that, I will, which he did lightning quickly, I will remind everybody that if you do have questions, you can submit them by typing them in again into that questions or chat section of your GoToWebinar control panel. And with that, without further ado, I'll go ahead and pass the mic to Rich. Enjoy today's presentation, everybody, and thanks for being here.
Thank you again, Carla, for that very nice introduction. And hello, everyone. I'm so glad that you're able to join us for the webinar today, Finding Financial Assistance for Patients with Rare Diseases. As Carla mentioned, my name is Rich Citronbaum, and I'm the Vice President of Operations at the Patient Access Network Foundation, otherwise known as the PAN Foundation. Today, I'd like to speak with you about rare disease funds that we have at PAN and about our outreach to the rare disease community. At the PAN Foundation, we're committed to helping people living with rare diseases to find financial support, as Carla mentioned before. And I'm so excited to connect with the rare disease community today and to share our resources with you all. Oh, okay, I was able to get to the agenda slide. Success. Today, I'll introduce you to who we are, the impact of the assistance that we have for patients with rare diseases, and how you can apply and receive for financial support at PAN. Please feel free to send us questions during the webinar, as Carla mentioned, in the chat box. We'll try to get to as many as possible. And if we run out of time at the end of the webinar, we will receive the questions that remain and will respond separately. So please feel free to ask your questions. Okay, so let's go ahead and get started on what we do and why we do it. As you may already be aware, there's approximately 7,000 to 10,000 known rare diseases, and many are life-threatening, hard to diagnose, and also, of course, to treat. According to a study done in 2021 at the National Institutes of Health, rare diseases collectively affected 24 to 30 million people in the United States alone. The annual direct medical cost is estimated to be over $400 billion, which is similar to those with cancer, Alzheimer's, and heart disease. The estimated treatment costs per person ranges from $8,800 to over $140,000 per year. In fact, individuals with rare diseases face medical costs that are approximately 3 to 5 times greater than those who do not have a rare disease. For these patients, access to medically necessary treatment is critical for successful disease outcomes. However, this access can be blocked by the high out-of-pocket costs, which can add up very quickly, increasing the financial burden. And so finding financial help to cover these out-of-pocket costs is vital for patients. At the PAN Foundation, we believe, and as Carla mentioned before, we believe that out-of-pocket costs should not prevent anyone from obtaining medically necessary treatments. So today I'll share some information with you about how PAN can help remove some of the financial barriers and alleviate the high out-of-pocket costs for those living with rare diseases. So let's get started about who we are. PAN, Patient Access Network Foundation, is a national patient assistance organization that helps underinsured people pay for their out-of-pocket treatment costs while advocating for more affordable care. Since our founding in 2004, we've provided over 1 million underinsured patients with more than $4 billion in financial assistance. We currently have more than 70 disease funds which we provide support with, and of them, there are more than 25 that are specific for rare diseases. And of course, we continue to hope expanding these to reach and assist more people in the future, and we do that every day. Currently, we have 3 types of assistance programs to help patients with their out-of-pocket costs. The first program is our Medication Assistance Program, which assists patients with deductibles, copays, and coinsurance for their medications. The second program is our Premium Assistance Program, which assists patients in paying their monthly primary or secondary health insurance premiums. And the third program is our Transportation Assistance Program. We broadened this program recently to include all of our disease funds. This program covers travel expenses that patients have and assists them with transportation costs relating to social determinants of health. Once approved, Transportation Assistance Program covers things like gas, rideshare, car rentals, parking, and airfare. We also cover approved other costs such as lodging at hotels and temporary housing. I also want to note that to qualify for our transportation program, the patient must be enrolled in one of our medication assistance programs that I mentioned before, such as our medication copays funds. Finally, the transportation program assistance is not limited to just rare diseases, but it covers all the disease states and all the funds covered by PAN, including chronic diseases and oncology. Also, all of our programs are allocated in the form of what's called financial grants to help patients pay for prescribed medications, transportation, and I also mentioned insurance premiums. As I mentioned previously, there are more than 25 disease funds that help cover for rare diseases. Overall, as mentioned before, we provide assistance for more than 70 diseases, ranging from chronic, rare, and oncology diseases. To see a complete listing of all of our current statuses and all of our funds for all of our programs, we highly encourage you to please visit our website at panfoundation.org. While many are listed here on the slide that you're seeing currently, they can change every day, so we do encourage you to visit our website at www.panfoundation.org. A common question we receive is what medications we cover. Every disease fund has a list of covered drugs that are considered for reimbursement. PAN is also a diagnosis-based organization, and our funds, in addition to our formulary. We have a complete list of all of our diagnosis codes under each disease fund. To explain that a little bit better, the patient must have the disease that is listed for the fund, and they must also be on a medication that is included in our list of covered medications under the fund. For each disease fund, we covered FDA-approved medications and those that are listed in the official compendia or evidence-based guidelines indicated for the specific disease states. More specifically, this includes all prescription medications in the fund formulary, such as brand and generic medications, bioequivalent or biosimilar medications, specialty drugs, and radiopharmaceuticals. Now that you know what PAN covers, I think it's also important to briefly touch upon what is not covered, since we receive a lot of requests for payments for these products and services. First, PAN is considered what's called a payer of last resort. This means that we pay the patient's responsibility or their out-of-pocket costs after the insurance makes a payment. Therefore, we do not reimburse for any medication which is covered at 100% by the health insurance, or medication that the insurance did not make any payment on. Also, as discussed earlier, the medication must be on the disease fund formulary to be considered for reimbursement. However, there is an exception to this rule. If a medication is indicated or guideline recommended for a specific disease state, but is not listed on our formulary, you may submit a request to our website or call us to add the drug to our formulary. We will review your request to provide a determination. Finally, as I mentioned before, it's important to understand what we don't cover. We do not cover services such as doctor visits, lab work, genetic testing, ER or hospital visits, or diagnostic testing. While I don't necessarily have a slide for this, I thought it was important to add some information at this point and make sure that those that are listening understand we have 3 fund statuses at PAN. So a fund can be in one of 3 statuses at any particular time. Those statuses are open, closed, and open in the wait list only. So first, let me mention what is open. When you go to our website or hear from us that a fund is open, this means that the funding is currently available and the disease fund is open for all to apply for assistance. The next status is the status of closed. This means that funding is currently not available in that disease fund. So if you're interested in applying for assistance when it opens, you can add yourself to the wait list. And we also call this the disease fund wait list. When you sign up for the wait list, you will receive a notification when the fund opens and the wait list status changes to apply. The third and final status is open to the wait list. Open to the wait list means that funding is currently available for the disease fund, but it's open to those who are currently on the wait list. So we open the funds to those on the wait list first for a short period of time of 2 days. And then if there's funding that is available after it's open to the wait list, it moves to the open status. If there's no funding available because the funding was exhausted by people on the wait list, it then moves to closed and people can then join the wait list. So it's really critical to understand these different fund statuses at PAN to optimize your search for financial assistance. I apologize that I did not have a slide on that, but I felt it was really important that I mention, as there's often confusion about the 3 statuses that we have at PAN: open, closed, or open in the wait list only. So next I'll move on to talk about how to apply. The next few slides will talk about applying for assistance with PAN. There are 4 easy steps to keep in mind when applying. Step number 1 is on the slide you see before you. Step 1 is to check to see if the disease fund is open. There's several ways to do this. First, you can go to the PAN website at panfoundation.org. Under Find a Disease Fund, or type the name of the disease fund on the home page. I highly encourage those on our webinar today to use the website as calling our contact center can often have long wait times when funds open. And our website is very, very easy to use. So I highly encourage those that are listening, since you are proficient in using a computer, thus you are on our webinar today, to visit us at panfoundation.org to find out if a fund is open. Another way is by visiting our portals to verify the fund status under disease fund and the medications tab. So you can go to the portals provided in front of you. And while we have very different types of people joining our webinar, if you are a provider or work in a provider office, you could see the web address for our provider portal. We also have a pharmacy portal, and we also have a patient portal. For those that are not proficient with using portals or visiting our website, or for the underserved who do not have access to broadband or internet or possibly a computer, certainly we have our contact center available, and you can call us at 866-316-7263 to find out the status of all of our disease fund. We are available Monday through Friday, 9 a.m. to 5:30 p.m. Next is step 2. Patients will need to verify if they meet the eligibility criteria for the disease fund that they're applying to. The following in general are our eligibility guidelines for disease funds. But it's important that they do vary from fund to fund. So this is general information for those attending the webinar today. It's important that the specific information be found on our website or by calling us. Number 1, you must be getting treatment for the specific disease state you're applying. This means if you're applying for assistance for the hemophilia fund, you must have a diagnosis or one of the subtypes under the hemophilia diagnosis fund relating to the ICD-10 codes. 2, the medication or product must be listed under the specific disease fund formulary, as I mentioned before, and you must be covered by health insurance, as I described in previous slides. 3, the patient's income must fall 400 or 500% at or below the federal poverty level as specified by the assistance program. It's important to note that the insurance and income guidelines vary for each assistance program. So be sure to verify this and all the program guidelines on the specific disease fund page. To determine the federal poverty level, that can be found online. It is updated on an annual basis, and the federal poverty level is based on income as well as household size or number of people living in a particular household. So it can vary from patient to patient based on those parameters. 4th, the patient must live and receive treatment in the United States or the U.S. territories, although U.S. citizenship is not a requirement. Certain programs, such as a transportation fund, have additional requirements. So again, we encourage you to check the PAN website for more details. The next step is to gather all the required information. If you meet the criteria listed on the previous slide, you'll need to gather all the following information before starting the application process. You'll need the demographic information of the patient, such as the name of the patient, address, phone number, and email address, the diagnosis and the medication name, as I described before, the health insurance information. Also, as just mentioned, you'll need the income, your income, and the number of people in your household. And lastly, the physician and facility contact information. The following slide here has an example of the Gaucher disease fund page from our website. When you clicked into the assistance program page, you can verify the assistance amount, the eligibility criteria, and also start the application process online. So everything that you need will be on our website, and this is just an example of what you may see when you navigate to a specific disease fund. But before you do that, you should make sure that you verify that the medication is covered for reimbursements, the disease fund subtypes, and you also find related advocacy and alliance partner information for the disease state right on this page as well. I'll talk a little bit more about our advocacy programs a little bit later on in this webinar. The next step and the last step in the process is to submit an application. So now you're ready to submit that application. There are three main ways to do this. As previously mentioned, you can apply directly on our website. You can log into one of our three self-service portals that are listed here. I've listed them again for your reference. The provider portal serves our healthcare providers. The pharmacy portal is intended for our pharmacy partners. And our patient portal is designed to serve our patients and their caregivers populations. Lastly, as I mentioned before, and I'll repeat again, you can call us at any time at 866-316-7263, and we're available Monday through Friday, 9 a.m. to 5:30 p.m. Eastern Time. On average, it takes less than 10 minutes to complete an application, and our enrollment decision is instant. We will provide you with all the enrollment details and processing information right away, as well as we'll provide information either through our portals via email or mail that information to the patient for their records and references. Once you're enrolled, you can immediately begin submitting your claims to PAN for reimbursement. If you're a pharmacy, you can submit through the pharmacy, and if you're a medical provider for medications that are submitted through medical benefits, you can submit those to PAN as well. We want the reimbursement process to be quick and straightforward, so we provide several ways to submit your claims. If you receive your medication from a pharmacy, your pharmacy can bill PAN on your behalf. If you receive,
at the front door.
I apologize for the interruption. My Alexa is speaking to me, so I apologize for that. If you receive your medication from the doctor's office, the doctor's office can also bill PAN. If you prefer to bill PAN directly, you can receive the prescription label. You can submit the prescription label or the explanation of benefits for the services or medication you receive at the pharmacy with a complete direct member reimbursement form to PAN. The direct member reimbursement form can also be found on our website. Or you can submit an explanation of benefits for services or medications received at the doctor's office with a complete direct member reimbursement form. Additional information on filing claims and the direct member reimbursement form can be found on our website at panfoundation.org under the Get Help section. So here are a few reminders about PAN grants based on questions that we get often. Each PAN grant eligibility period is for 12 months. So it's a 12-month period. However, for first-time enrollees to any disease fund, we provide a 90-day look-back period to allow reimbursements for claims you may have acquired before contacting us. We also have what's known as a grant use policy, which requires a claim submission and payment every 120 days to keep the grant active through the grant eligibility period. So if a grant is not used at least once every 120 days, the patient will receive a notification that it would be at risk of cancellation to allow for grants that aren't being used to potentially allow those funds to be used for other patients in need. So we do have a policy that it should be used once every 120 days. Of course, if a patient has an exception or if they are disenrolled for some reason, we do have ways that we can re-enroll patients with this policy. But it is important to know that we do have this policy, which helps other patients in need if funds and grants are not being utilized. We also have additional assistance. Our grants are intended to provide 100% assistance support for most of our patients. What we do is we look at the historical data and industry trends to determine how much a patient is going to need for a specific disease fund in terms of their out-of-pocket costs in a given 12-month period. And then we allocate that dollar amount to that fund. If a patient needs additional assistance because their out-of-pocket costs are higher than average, we offer additional assistance called second grants. And these second grants are intended to cover the remainder if used within that enrollment period that the fund, and if the fund is opened. So if the fund remains open and we have funding available and a patient is in need and exhausts the entire amount of the first fund, let's say in a short period of time of 3 months or 6 months or whatever amount of time, and there's time remaining on that 12-month grant, they can apply for the second grant and get additional funding, but it must be used within the original 12-month period of the original grant. We also review our assistance amounts annually, and we have a third-party actuarial firm that helps us determine how much need there is out there for patients. And we do make adjustments to ensure patients receive adequate financial support throughout the year. So I wanted to mention these because our grant use policy can be confusing to patients and providers and pharmacists. We get a lot of questions about this, as well as the opportunity to receive additional assistance through second grants is a very commonly asked questions. So I hope I was able to answer many questions that you might have listening to this webinar. Lastly, don't forget to renew your grant after 1 year eligibility period ends. We do get common questions about when can a person apply for a renewal, and they can apply for renewing their grant up to 30 days before the current grant ends. Okay, so I believe and have found that the information contained on this slide here serve as an example of the most common questions that we get about utilizing PAN grants. One way to stay connected is through our portals. As I've discussed several times earlier, we have 3 portals, one for the patient, one for the provider, and one for the pharmacy. On all 3 of the portals, you may utilize the following features, and plus there's many more features, but here's just an example. You can apply for assistance and see fund statuses. You can manage your accounts. You can renew your eligibility period and grant, you can review, your eligibility period and grant balance. You can sign up for a second grant if you're out of funds. You can renew your grants starting from 1 month, as I just mentioned, before the end of your eligibility period. And you can also review any correspondence and letters regarding your account or notifications that we might send you. In addition to those features, you may also be able to view process claims and run reports, as well as upload and submit claims on the portals. Finally, we do have an announcement and update section that are displayed on the pharmacy and provider portal login pages. And PAN allows you to do this through PAN's portals, which are very easy to use, all without having to wait in line when you're picking up the phone. And as I mentioned, when we do open funds, and especially during certain times of year when we open many funds, our waits on the phone can be rather long. So the best and quickest way for those who have access and ability to do so is to go onto our website and utilize our portals. We want to encourage you to stay connected with us once you enroll with PAN. We understand that you have a busy schedule, and because of that, we have made our processes quick and simple for you to stay connected. We provide many resources to help you along the way. As previously mentioned, PAN has a transportation add-on program for patients enrolled in a copay disease fund. The transportation program offers $500 for travel for things related to social determinants of health. It may include things like traveling to and from doctor's office or for pharmacy visits to pick up medications, but it's not limited to that. It covers all major modes of transportation, including gas and lodging, and it comes in the form of a prepaid debit card. And again, you must be enrolled in one of our other types of copay, in one of our other funds, a copay fund, for example, to be eligible and apply for our transportation assistance funds. As I mentioned before, we partner with many national patient advocacy organizations. We understand that managing an illness is complex, and our patients who apply for assistance with PAN may need additional support beyond financial aid. And this is one of the things that makes PAN different. Our patients have many questions about their disease, treatments, side effects, medication adherence. They may also benefit from connecting with a compassionate community that can help patients deal with the physical and emotional complexities of the disease. Just some of the advocacy organizations that we partner with can be seen on the screen here. And these organizations, while we help with the out-of-pocket costs relating to medications and transportation, these advocacy groups provide more of a holistic support in addition to what we provide at the PAN Foundation. PAN also created, another thing that PAN does differently than other foundations is we created a, sorry, I hope you can still see my screen.
There we go. Still see the screen. There you go.
Very good. I apologize. I accidentally pressed a, thank you, Carla, for helping with that. I accidentally pressed a button there.
It happens.
Excellent. Thank you so much. Another thing that PAN also does differently is we created a free web-based application called FundFinder. It's the first of its kind, and it's a web-based application that helps all audience track disease fund status across 9 charitable copay assistance foundations that are similar to PAN. Once you sign up, you may follow any disease or disease fund and receive notification alerts via email or text messages when the specific fund opens at any of the foundations. This is part of our advocacy efforts. FundFinder helps you to save time by not having to check multiple websites frequently. Our goal is to help you to find the support and resources that you need and spend less time on the manual work to find assistance. When the patient or caregiver or others apply at PAN, they are given an option to receive communications from an alliance partner, as I mentioned before. Our alliance partner will reach out to those who are interested in learning more if the patient opts in. The FundFinder application or web-based site can help patients stay connected and learn more about disease states and funds and financial assistance that are opening in real time. We know that the PAN Foundation is one of many resources to help you with out-of-pocket costs, and we encourage you to reach out to us. By doing so, we can listen to your needs and understand how we can help. So with that, I want to thank you all so much for joining today. To learn more about the PAN Foundation and our programs, as mentioned before, visit our website at www.panfoundation.org or sign up at our portals or call us at 866-316-7263. And with that, I will turn it back over to Carla. And I appreciate you joining me and listening in today. And I'm glad to answer some of the questions that have been submitted as you've listened to the presentation. Thank you again, everyone.
Rich, thank you so much for that very thorough explanation about what the PAN Foundation is. And I love that you added what you guys aren't, and also how to go about getting help for yourself, a loved one, a patient, or a client. As I said in the beginning a number of times, Needy Meds has been a proud partner of the PAN Foundation for a number of years. And what they really where they really stand out is not only the breadth and scope of financial support and resources they provide for the patients that turn to them, but they really go out of their way to make sure that barriers to access are removed. In particular, Rich, first of all, as evidenced by this webinar, they regularly come back to Needy Meds to present updated versions of their webinars. So check out the Needy Meds calendar for other upcoming PAN Foundation webinars. As evidenced by how they go above and beyond. I said earlier on how easy their website is to navigate, and that's very true. And Rich had an opportunity to highlight the 3 different portals available for patients. And Rich, it's patients, pharmacists, and providers. Is that correct? The 3 different portals?
That's correct.
And that makes it much easier. So check out those portals and really check out Fund Finder. That is a relatively new resource, and it's especially new that you can get updates via text, which I think is super important, because getting them via email, it has always been helpful. But as we know, we're all guilty, at least most of us, of having that text right in the palm of our hand or our pocket. So now you will know, you'll be notified immediately when there's an update that you'd be interested in through the Fund Finder. As Rich also said, he added quite a few interesting things throughout his presentation to make sure he addressed common questions. And actually, you did, Rich, because we were getting questions, and along the way, you did answer those. But there are some others that we will get to, and as Rich said, in a little bit, so don't worry about that. In the meantime, a reminder to how to submit questions, and you do that by typing them into the questions, or for some of you, it may be the chat section of that GoToWebinar control panel on your screen. Another thing Rich said, which is very true, managing an illness can be complex. So if you are having difficulty not only affording your healthcare expenses or other healthcare costs, but maybe you're looking for disease specific information, any of the above and more, we encourage you to also rely on Needy Meds as a source of support. What you're looking at on your screen are all of the different healthcare savings resources you can find on needymeds.org to help you meet your healthcare needs. And these programs will help you afford medications, but they're not limited to financial assistance for medications. They will also help you find support for other medically related costs. So please visit our website, needymeds.org. Reach out to one of our call center counselors at 1-800-503-6897. And again, I will have that contact information and the PAN Foundation contact information up again later in the presentation as we wrap up. And I also encourage you to check out upcoming webinars, and you can check those out on needymeds.org, and you will find, as I said, future PAN Foundation webinars. You'll also find a bunch of webinars about Needy Meds and the resources we offer. So check those out and sign up if you'd like to learn about some of those healthcare savings resources you're looking at on your screen right now. So let's go ahead and get to those questions coming in. While we do so, as promised, there's a contact information for the PAN Foundation on your screen. Their call center is 866 316 7263. Their website is panfoundation.org. And what's not on this contact information screen is FundFinder. If you're interested in that, you simply, I believe, Rich, go to fundfinder.org. Is that correct?
Yes. Thank you for
Great,
mentioning
great.
that.
Yeah, I just wanted to make sure everybody was aware of that because I, for one, am really impressed with that tool, and I think it's just the easiest way to stay up to date onto what you may be interested in. So let's get to those questions coming in. And as I said, as you guessed it, Rich, you did answer a lot of them along the way, so that's great. But we're gonna dive into a few others that came up that will give you an opportunity, I think, Rich, to really drive home some important points. So one question that came in pretty early on is an audience member shared that their rare disease is actually not currently on the list of disease funds, and they want to know, how can I request this fund?
Well, first, let me thank you so much for that question, whoever asked that question. It's a terrific and common question that we receive. If you don't see your rare disease on our list of disease funds, you can submit a message with the disease state to us via our Contact Us section on the website. There's a specific form under the Contact Us section, and there's a drop down where you can choose New Disease Fund Request. So please, if you haven't already, submit that to us. We consistently review disease states to find additional ways to assist patients with high out-of-pocket costs. And although PAN may not support your disease state at this time, it's important to remember, I know we've mentioned it several times, including Carla just mentioned a few minutes ago, other charitable copay foundations may have a fund for that disease state available. So we do recommend that you sign up for FundFinder to determine if your disease state is available at another foundation as well. So the 2 points of advice is sign up for FundFinder and submit a request to us so we can review and get back to us via our Contact Us form, specifically under the Disease Fund Request subtype.
So helpful. Thank you for the thorough answer, and to our audience member for asking it. Another question, and as you can see, we're moving right through the questions coming in, was, I bet, another question you and the PAN Foundation team gets asked quite a bit, which is, when applying for assistance, do I need to provide any paper documents, for example, to actually verify my income?
Another great question. And typically, no. The answer to that question is no. As a reminder, I believe I mentioned this earlier, our application takes about 6 to 10 minutes to complete, so it's done rather quickly. You'll need to provide your household income along with other demographic information, your provider and medical information. You also need to have your household income, your household size. Um, to provide to us. We do, there are situations where if there is not a match to that information, to the check that we do behind the scenes, we do provide what's known as a conditional approval. And the conditional approval does have requirements that you would need to send in some additional documentation about your income. Uh, uh, but in general, the vast majority of applications do not require any paper documents other than the exception that I provided. So typically, no. Conditional approval would require additional paperwork to be provided to us. And we do have secure sections of our website to allow for that information to be provided.
So helpful. And we have covered a ton of information in today's presentation. So just a reminder to everybody, if you want to share information about PAN Foundation, certainly just direct them to their website, give them the phone number for their call center, or recommend that they check out upcoming webinars for future PAN Foundation webinars. And also, they can view this one, which again will be recorded and converted into a video uploaded onto the Needy Meds YouTube channel. So you can refer back to it and share it with others. So, Rich, getting back to these questions submitted by our audience members, another one that came in, I believe you touched on, but it's a great opportunity to drive it home. This audience member wants to know, would I be able to apply for a second grant if I know I'm going to need more money for the rest of the year? That's a great question.
Yes, I'm glad that this question was asked again, because as I mentioned earlier, that this is one of the more confusing areas of what we do, but it also is one of the most beneficial areas for patients in need, especially if they have higher than normal out-of-pocket costs. So a couple of important points related to, again, the second grant concept and how it works. First, you're only eligible to apply for a second grant when the grant balance from the first grant is at zero. So you really can't apply for a second grant in anticipation of that need. It has to be when the grant balance is zero. Once the grant balance is at zero, then you can apply for additional assistance through the second grant at any time during the eligibility period. And that is if the disease fund is open. So if there's money available, you can and your balance is at zero, you can apply and potentially be approved for a second grant. And also, as an additional reminder, that second grant money is only allowable to be used through the remainder of that first grant period. So the original 12 months, if you run out of funding at the 6 or 8 month point, you can apply for that second grant. If there's money available and you still meet the eligibility requirements, you'll be approved, and then you'll get a second grant that can be used for the remainder of that time period, whether it be 4 or 6 months or whatever the remainder of the period is of that initial grant. So I hope that was helpful, as I know that can be a confusing area.
Thank you so much, Rich. And from the feedback, it looks like it was helpful and did clear that up.
I'm glad to hear that.
So another great question coming in: how does someone ensure that their medication will be covered before applying to PAN?
Yes, you can look at what's called our formulary, and it's on our website at panfoundation.org. You need to refer to the specific disease fund by typing it into Find a Disease Fund, and in that area, all the medications will be listed. Of course, you can call us for that information if you don't have access to a computer or reliable internet service. But the easiest and quickest way to find out if a medication is covered is to look online. And if your medication is not covered, then you can certainly reach out to us to see if it should be covered. I did describe some of that during the webinar, that it must be FDA approved or available on the compendia and for approval. So again, best way is to go on the website, and the quickest way is to go on the website to find out if it's covered.
Perfect. And as Rich said, a lot of these questions that we're getting to, it's an opportunity for Rich to drive home some points that were touched upon or made throughout the presentation. But as I said, I think that's not to sound like a broken record myself, but that's a great reason to go back and hang on to the recording of the PAN Foundation webinar, because you can revert back to some of the questions you may have. And speaking of questions, we're going to get to a few more before we wrap it up, because these are great questions that I think really would benefit everybody participating today. So this is a question about how the PAN Foundation asks users to submit a claim every 120 days to keep their grant. And the question is, why do they have to do that? Why does a claim have to be submitted every 120 days? And I'm interested myself.
Another great question, and as you saw earlier, I'm so glad people are asking additional questions about this, because if I were to list the things that are most confusing, and it's that slide I mentioned before about the grant use policy, which I'll get into in just a second, the second grants, and when can I renew. So first, we want to make sure that you're using your grants as intended. So if we don't receive a paid claim once every 120 days, we'll cancel the grant. And the reason for that is because we have so many patients in need, and sometimes we run out of funding. So by ensuring that patients are actually using the grant and have a need for it, it allows us to bring money back into the fund and help the many patients that are in need. If we didn't do that, that money would be locked up, it wouldn't be used, and we couldn't provide it to other patients in need. But here's what we do also. We notify the patients every 90 days if we don't receive a paid claim. So there'll be a notification sent to let the person know. And also, if there's any extenuating circumstances, then we encourage you to contact us. So some examples of extenuating circumstances are some patients only receive treatment every 6 months. They travel to a facility to get an infusion or other types of things. There may be other extenuating circumstances, such as the patient was in the hospital or other things. So we encourage you to contact us. We can make exceptions, we can extend, and if a fund was disenrolled due to this, you can also reach out to us to see if an exception can be made to reinstate the patient. So I tried to answer that broadly, but I hope that was helpful and gave additional information, even more than I provided earlier.
Thank you again, Rich. Very useful. And thank you to our audience for participating. We're going to wrap it up with just a couple of more questions. So don't worry if you submit a question, we don't get to yours. As we said, we'll follow up with you via email, but you can always reach out to the PAN Foundation at the call center on this indicated on your screen. Again, that number is 1-866-316-7263. Their website is panfoundation.org. And as I mentioned, not on the contact information screen that you're looking at right now, you can also go to fundfinder.org. And I'm mentioning that again because we actually, which I'm pleased to see, have a question coming in about the Fund Finder. And it's a great one, which is, can I sign up for Fund Finder if I don't have an email account?
Yes, I want to answer that question, but Carla, I would feel very badly if we ended this webinar. I didn't mention something, and that is how appreciative we are at the Patient Access Network Foundation, the PAN Foundation, for our partnerships with Needy Meds. We've had a long-term partnership with Needy Meds, and we often refer patients to Needy Meds when we're not able to provide support, as people call us for disease funds or medications that we don't cover, and our first place to go is needymeds.org. So we're appreciative of this opportunity, we're appreciative of this partnership, and we're appreciative of our ability to do these webinars and get the word out. So thank you, Carla, and to all the team members that I work with at Needy Meds for your ongoing partnership.
Our pleasure.
And the question related to Fund Finder, glad to answer that. The question, as a reminder, if I heard correctly, is what do I do if I don't have an email account? So
that's correct.
Currently, the way that Fund Finder is set up is that you will need an email address to initially sign up for Fund Finder. We do get this question every once in a while, but it's needed just for the sign up process to set up a user access to Fund Finder. So many of our patients utilize a a friend or a family member or a child or a caregiver with an email account for the initial setup, because we do send an email to verify the registration. However, afterwards, you can opt to only receive text message notifications once you sign up. And Carl, I know you mentioned earlier about text messages, and we find text message beneficial, as many of the demographics that we serve either are underserved communities that don't have necessarily access to a computer or broadband, but they will have access to a text message. And even some members of the demographics that we serve um, are elderly and don't necessarily use the internet or emails. Um, Even a large percentage of that population do use a cell phone and can receive text messages. So that's why I reiterate again here, the Fund Finder is a great tool, but you do need an email to sign up initially and to validate the registration. Then you can sign up for text messages. So I hope that was helpful.
Great question, and very easy to understand answer as always. Thanks, Rich. And let's wrap it up just with one more question. And I'm guessing you guys get this a lot, especially recently, which is, does the PAN Foundation cover vaccinations or ER visits?
Well, unfortunately, at this time, PAN does not cover doctor's visits, lab work, genetic testings, vaccinations, and I think the question was ER visits. We don't cover ER visits. We cover prescription medication copays for all assistance programs, and we do cover for some, but not all, disease funds, some medical devices for select disease funds, but we do not cover vaccinations currently or ER visits. Um, uh, it is a topic that has come up, but I don't know what that status is at that time. Things can change in the future, so we encourage you to visit our website at panfoundation.org for a full listing of our formulary, as we know that more and more use of vaccinations are coming up. Um, I believe that is an area that we're looking at, but I can't make any guarantees on this webinar as to whether or not those will be covered in the future. ER visits also are not currently covered.
Thank you so much, Rich. And I'm actually happy that we landed on this question for the last one, because there's actually a lot of points about that. As Rich said, although currently the PAN Foundation doesn't offer financial support for vaccinations or ER visits, our group of nonprofits in the healthcare community that work to help patients afford their healthcare needs, we are ever changing what we're able to cover, what we're able to provide. So, as Rich said, be in regular contact with the PAN Foundation and Needy Meds, because if there is something you're looking for help affording, but we can't help you now, it doesn't mean we won't be able to help you in the future. It also gives me another opportunity to stress something Rich also said, which is really important, that I will also and I will say that Rich wouldn't mind me conveying this sentiment on behalf of the PAN Foundation as well, which is that we, again, in this community of nonprofit healthcare organizations that try to help patients afford their healthcare expenses and be successful on their healthcare journeys, is that one of the hard realities that we have all accepted is we can't, as individual organizations, unfortunately, be the answer to everyone. So, with that in mind, we do our best to work together to make sure that as a whole we're able to fulfill your need as a patient or a loved one of someone who is in need of care, or if you're looking to help a patient or client. So if you turn to one of our organizations and we can't meet that need, we will do do our best to try and connect you with an organization that can. And I think that's a really important point. So I'm glad I had the opportunity to drive that home. We don't want to take too much more time on this question segment. I think we got to a lot. So with that, I want to thank my friend and colleague Rich for taking time out of his very busy schedule to share his expertise and his passion for the PAN Foundation with the Needy Meds audience. And as always, a big thank you to our Needy Meds audience for taking time out of your day to learn more about our valued partnership with the PAN Foundation. Stay in touch with both of our organizations by visiting our website, reaching out to our call center counselors if you need some assistance, and following us on social media. Thanks so much, everybody. We do look forward to seeing your names pop up in future webinars. Have a happy and healthy rest of the day. Take good care, and thanks again, Rich.